History of first diabetic oral drugs. In the early 20th century, the world of diabetes was a grim one. Insulin, discovered in 1922, offered hope, but its administration by injection was cumbersome and inconvenient. For countless diabetics, it remained out of reach, leaving them to manage their illness with strict diets and harsh treatments. But in the shadows of research labs, a revolution was brewing. Scientists were desperately seeking a way to bring the life-saving benefits of insulin to the masses, and their focus turned to the ancient herb known as goat's rue. For centuries, goat's rue had been used in folkloric remedies for diabetes. Its effectiveness was anecdotal, shrouded in mystery, yet it held a glimmer of hope. In 1918, scientists finally unlocked the secrets of the plant, isolating a compound they called guanidine. This discovery sparked a chain reaction, leading researchers to explore other guanidine derivatives. One such researcher was a young French chemist named Jean Stern. Fascinated by guanidine's potential, he spent years meticulously studying its properties. In 1929, after countless experiments and failed attempts, Stern made a breakthrough. He synthesized a new, more potent guanidine derivative, which he named dimethylbiguanide, later shortened to the familiar name Metformin. Metformin was unlike anything the medical world had seen before. Unlike insulin, it didn't require injection. Instead, it could be taken orally, offering a convenient and accessible way for diabetics to manage their blood sugar. Early trials were promising. Metformin proved effective in lowering blood sugar levels, and unlike other diabetes medications of the time, it had minimal side effects. However, the road to widespread acceptance was long and arduous. Skepticism abounded, and clinical trials were expensive and time-consuming. It wasn't until the 1950s that metformin finally received its due recognition. A pivotal study published in The Lancet established its efficacy and safety, paving the way for its global adoption. Metformin quickly became the go-to medication for type 2 diabetes, transforming the lives of millions. Today, metformin remains the cornerstone of diabetes treatment. It's the most widely prescribed diabetes medication in the world, a testament to the vision of Jean Stern and the countless scientists who paved the way for its discovery. The story of metformin is not just about a drug, it's a story of human ingenuity, perseverance, and the relentless pursuit of a cure. It's a reminder that even the smallest herb, when coupled with scientific curiosity and unwavering dedication, can unlock life-altering discoveries. And it offers hope for the future, inspiring us to continue the quest for better treatments and ultimately, a world free from diabetes. The discovery of metformin revolutionized diabetes treatment, but the battle against the disease was far from over. As millions found relief with the oral drug, scientists continued to search for new and improved therapies. The quest for the second spark, another safe and effective oral medication, was on. The 1950s and 60s saw a flurry of activity in diabetes research. Laboratories across the globe explored various avenues, investigating the pancreas, hormones, and the complex metabolic pathways underlying the disease. One promising avenue emerged, understanding how the body secretes insulin. In the 1970s, researchers identified specific cells in the pancreas responsible for insulin production, the beta cells. This discovery opened a new chapter in diabetes research, as scientists focused on how to stimulate these cells to release more insulin. One particularly promising approach involved a naturally occurring substance called sulfonylurea. This compound, found in plants like the Indian hyacinth bean, had been used for centuries in traditional medicine to treat diabetes. Scientists in Germany and France independently began testing sulfonylureas in the 1950s. Their efforts led to the development of the first-generation sulfonylureas, such as tolbutamide and chlorpropamide. These medications offered a new option for diabetics, but they came with limitations. They were less potent than metformin and had a higher risk of side effects, including hypoglycemia. The quest for a better sulfonylurea continued. In the 1970s, researchers at Hoechst Pharmaceuticals, now Sanofi, synthesized a new sulfonylurea with improved properties. This drug, named glyburide, also known as glibenclamide, was more potent and long-lasting than its predecessors, with a reduced risk of hypoglycemia. Gliburide's arrival marked a significant leap forward in oral diabetes medication. It quickly gained popularity, becoming a mainstay in diabetes treatment alongside metformin. Together, these two drugs offered patients a wider range of options and improved control over their blood sugar levels. The story of the second oral diabetes drug is not just about a single invention. It's a testament to the power of collaboration and global scientific exchange. Researchers from different countries, driven by a common goal, built upon each other's discoveries, culminating in the development of a life-changing medication. Today, the search for even better diabetes treatments continues. New classes of oral medications, like incretin mimetics and sodium glucose cotransporter 2, SGLT2, inhibitors, have emerged, offering greater efficacy and fewer side effects. The journey from the goat's root to the modern era of diabetes management is one of remarkable progress. It's a story that inspires hope for a future where diabetes can be effectively managed and even prevented, offering a brighter future for millions living with the disease. Gliclazide, a story of serendipity and scientific progress. Gliclazide, a third-generation sulfonylurea medication, holds a unique place in the history of diabetes treatment. Its story intertwines with the development of the broader class of sulfonylureas, showcasing the remarkable journey from folklore remedies to modern medicine. This drug is still widely in use under the commercial brand names, Ducati's, Diamacron, Edicil, Glitex, Loglita, Lomzarin, Notstal, Vamju, Zacloseg, and Zycron. The origins of gliclazide can be traced back to the ancient use of the goat's root plant. For centuries, this herb was used in traditional medicine to treat diabetes, primarily due to its observed blood sugar lowering effects. However, the active component remained elusive until the 20th century. In 1918, scientists finally isolated the compound responsible for goat's root's therapeutic effects, guanidine. This discovery sparked intense research into related molecules, leading to the development of the first sulfonylurea drugs, tolbutamide and chlorpropamide, in the 1950s and 1960s. Meanwhile, French chemist Marcel Janbon stumbled upon a serendipitous finding in 1964. While studying the antibacterial properties of a sulfonamide compound, he observed that it unexpectedly induced hypoglycemia in patients. This observation led him to explore the compound's potential as a diabetes treatment. Janbon's discovery laid the groundwork for the development of gliclazide. Through years of meticulous research and refinement, he and his team at Servier Laboratories synthesized a new sulfonylurea derivative with improved properties. This molecule, named gliclazide, was patented in 1966 and approved for medical use in 1972. Gliclazide offered several advantages over its predecessors. It was more potent, longer-lasting, and had a lower risk of causing hypoglycemia. Additionally, it exhibited a unique beta cell selective action, meaning it primarily stimulated insulin secretion in pancreatic beta cells, minimizing side effects on other tissues. These advantages quickly propelled gliclazide to the forefront of diabetes treatment. It became a popular choice for managing type 2 diabetes, particularly for patients with specific needs, such as those with advanced age or impaired kidney function. Over the decades, gliclazide has undergone further development. Modified release formulations have been introduced, offering a more sustained release of the medication and improved blood sugar control throughout the day. Additionally, researchers continue to investigate its potential in combination with other medications for even better glycemic management. Today, gliclazide stands as a testament to the ongoing pursuit of better diabetes treatment options. Its story is a captivating blend of serendipity, scientific inquiry, and dedication to improving the lives of millions living with this chronic disease. As researchers continue to explore its potential and develop innovative formulations, gliclazide promises to remain a valuable tool in the fight against diabetes. Think, your health is very important for your family as well. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.